I'm Dr. Arun,
Hi, good morning. Myself, Dr. Rajat.
and we are Medjeevan.
Before I start my session and explain my product, I just want to know that how many of you hold a medical policy? There's out of them. How many of you have a policy which covers a dental procedure? Do you have one?
We have one,
Uh,
or just the consultation of the dental procedures. We have one.
Everything for cosmetic also, for pregnancy also.
Okay,
that's
it must be the
That's what we're
costly
talking
one.
about.
That is costly.
Yeah.
That is
It
quite
is
costly
3,000 rupees per month.
per month. Quite often something 1,000 rupees per year.
1,000 rupees annually.
3,000 rupees
One-
per month.
1,000.
We are providing for
I'm
We are
offering 1,000 rupees.
Annually. And what is the reimbursement? How much
Uh,
per year?
You will be entitled to have a free number of 10 number of consultations with all the doctors on the
Just consultation.
No, not just
What is
consultation.
IPG?
You will entitled to have free scaling sessions, cleaning, routine investigations, X-rays, polishings, plus other specialized.
I'm
Yeah.
talking about IPGs.
No, we're not dealing with it. We're just focusing over the dental because that's the only part which is not covered in the medical.
I
So
have.
let me put it in this way. Let us start with what our product is. We call our product is Health for All Dental. That's only for the dental part. And in Medjeevan, Medjeevan is a company that deals with customized.
Healthcare solutions for everyone because we are dealing with the schools, with the corporates, with the IWA, the societies, with the corporate other societies also, industries also, and the other co-working places also where they need any kind of a medical. Because most of the users are not aware about the medical field. Like as sir has left us, he was telling us about the audit of the schools, about the safety. Most of us are not aware that how many schools have a full-time doctor at their places. If they have a kind of a day boarding or they have a hostel, do they have a medical facility? They have own papers, but do they really avail that thing? Do they really provide that thing? So we provide all those kinds of things. And apart from all that, the main product which we already which we are focusing is that Health for All Dental, because all the medical aid policies does not cover any medical dental procedures because it's expensive also, and plus there is no government ruling.
It is especially designed for the dental part, right?
Yeah. We have our collaboration with Apollo Munich and Star Insurance also because it's our must have a combined package. We have a tie-up with some brokers, they can arrange for that thing, but we're
Must
not.
have a panel of doctors.
Yes.
listed over there.
We have a panel of doctors in Faridabad.
So is there any constraint on the age, like in case?
No.
No age.
No pre-existing, nothing.
If you have a pre-existing illness also, that will also be covered.
So
Again, you're
Because
telling
in
the charge
dental part,
1,000.
they
The
won't
concept.
keep age as a constant because you can have a dental
Because
problem at
in
any
these
age.
cases are higher in late age.
In old age.
Exactly.
Yes. So that would be
The reason behind this that because you do not get dental treatment in the early stage.
it's not today.
If you have treated your teeth in the early stage, that will
But
be.
what if my father he's growing 60 this year?
Still you are entitled to have all the facilities. There is no concern. No age, nothing related to even your medical conditions also. If you are suffering from diabetes and hypertension, that has a lot of impact on the dental condition. If you are having that thing also, still you are entitled to.
So
Aware each and
let
every
me make you understand the concept, right? Okay. So in Health for All Dental, we have three pillars. Like one is patient, the other one is dentist, and third is we as Medjeevan. And they all have a give and take relationships. So if I would say, if a patient pays us the annual premium of 1,000 rupees, the Medjeevan in return will give him a personal health manager.
We have a policy that once a person has enrolled with us, we'll be appointing a designated person for that. So that that person will not only keep a tab on daily activities, will keep on poking to have the routine checkup also. Because if you are getting yourself screened routinely, you will not have any grave disorder. We generally do because we have a medical policy. When we are suffering from acute abdominal pain for past 2-3 days, we go for all those colonoscopy and everything, get it in a hospital because it is covered. But for dental, we don't do that. So our manager will or the relationship manager will keep on poking the person to have at least a routine check.
Go
that
and
there is-
get yourself treated.
Yes.
Right. So the next service is quality assurance.
We have our inbuilt quality team also that keeps on auditing all the doctors who are on panel so that there is no degradation of the quality. Because there is a tendency that we always think that if person is offering something free or at a less price, the quality will be diminished. Because we have a portal, we have a team which keeps on auditing all those on a random basis just to check their quality. What are they providing?
We'll also give them rating on based
Yes.
on that, so that the patient can see on the website.
It's a completely transparent system. We have a login ID for each and every patient. They can visit the website, log in that, and can see all the doctors there. They can see their charges also, because there is nothing like that I can raise the price and then give you a discount. So prices are already fixed, it's on their portal. You can see the doctor as per your price, convenience also, your location also, rating also, reviews also, feedback also.
Why the name is Medjeevan? It should be somewhat related to dental or something.
No, we have
it's only one product.
We have products in medical also.
We are only selling one of our products.
We're right now
Yeah.
explaining just one product. We have other products also.
So the next is widespread dental specialists.
As we already told, at present we have 45 doctors with us on panel across the Faridabad, Goa, 45.
Delhi
And,
NCR.
Not Delhi, just Faridabad, Goa. We haven't done Delhi and Noida till now because of limitation of the team size. Because we are planning to enter the Delhi and Noida also. Till now we are just working in Faridabad,
Then we have comparison portal.
which I have already explained. It's available on the login. It's not available to all the users because we don't want to disclose the detail of the doctors. It is just entitled for only registered members.
So if
We
you,
have a
if
policy.
you if you buy a policy from us, we'll give you a login ID password, and you go log into that, and you can see all the details, dentists nearby you, and compare their ratings, their prices, their specialty, what they can do.
And plus our managers, they are somehow medically inclined, not the doctors basically, but the BSCs guys. They can at least help you in finding a right doctor. Because in dentist also we have 9 or 10 specialties. We generally see a dentist as a general dentist, but they are orthodontist, odontist, implantologist, cosmetologist. They are 9 or 10 specialties.
Not a problem.
And plus we have in-house one doctor available all the time, so that if someone needs a special advice, that doctor can provide at least a phone consultation.
And nowadays, dentistry also include cosmetologists.
Yeah.
That should
That
hair
so I was
transplant.
explaining about that skin cosmetic
Cosmetics.
procedure, we was talking about skin lifting. We have tied with them.
So next is appointment scheduling portal.
It's a portal, not like that we have on the Practo or anything. It's just we click on the login hours of the doctors, because most of the doctors work for 10 to 6, 10 to 7, 10 to 8, including a lunchtime 1 to 5. And we all are working. We generally reach our home from the office by 7. If we have to visit especially a busy doctor, then we have to take a whole day off. So we have tied with some doctors who have agreed to our terms and conditions that they will work in the hours, obviously on the prior one basis. But that portal will be exclusively available for those doctors. We have tied up kind of a 2 tie-ups. One is the executive time. Those doctors will be available from 6 a.m. to 11 p.m. And there is another team of doctors which is working for 25/7. It is for those corporate clients which basically works in the night shift also. Because hospitals generally close their OPD by 1 p.m. After that you have to go for emergency treatment. So for even simple toothache, if you go to hospital, they will charge you emergency charges. And doctor will also. But if you have enrolled with us, you can avail the service of that doctor. That doctor might not be available in your vicinity, it might be some 5 or 6 kilometers away also, but that will save a lot of time in itself.
So basically it is for checkups only or
No.
treatment?
Basic procedure, cleaning, polishing, x-rays, they are covered free of cost.
And root canal and all
Root
that,
canals we
insurance.
generally have around 30-40% discounts. That will be, it's a kind of a co-payment. You will be paying the 60% to the doctor, rest 40% will be from our side.
So you can see we have 2 types of categories in treatment, like basic essentials, like checkups, cleaning, polishing, that can prevent disease, right? And other are actual treatments. So all the basic essentials are free, and all the treatments are chargeable, but at a nominal price, much more low rate than market.
Our focus is to increase the awareness. Once the person is enrolled with us and he has pre-existing illness, yes,
Dental is a part where people are least about.
yes, and that's what we
We'll poke them. Go get yourself treated. You
That's
have free.
right.
You have free scaling. Go. Why don't you go?
And this point has come from our pilot study. We did a pilot study for 2 years.
Yes, we did a
And
pilot.
from 2011 to 2013
Where you did it?
in the Faridabad Gurgaon only. And during the first registration, when the user enrolled with us, when the first tenure was over and when we both were evaluating the data, we came to know that only 50% users have actually used their policy.
You have to
50%
ensure-
is like, I didn't get anything, so I
What
didn't
if a
visit it.
doctor wants to get empaneled with you? Like,
Yes.
what all are the procedures?
Just a form.
That's it?
Sorry, please, I didn't get your
Yes.
question.
Yes.
It's like a practice.
No.
Not a practice. Practice is just
My
providing
sister
reference.
The
is
getting on
present
board, I
for
think it should be the
interest.
same procedure. Like
Just
getting
a
on
form.
board a doctor.
That's it.
Kind of,
When is
but
it
not
on?
exactly.
And working model of practice is different.
Model is different, but get the onboarding procedure for doctors must be the same.
Almost same.
Yes.
Almost same.
You will just
They
fill a
are-
form.
e-commerce
They are
portal have the same
different on
registration
providing a
registration.
policy.
Yeah.
They are different on providing a policy.
Yeah.
Rental policy.
Practo is just providing you a kind of a aggregator or database of the doctors.
Exactly.
They are not providing you any kind of thing. Plus, our portal at present we are not basically branding doctors. In Practo or just Dial Aggregator, you have that always gold
Yeah,
class,
right.
5-star membership.
You
We are not doing that.
You are mostly consumer oriented.
Yes, we are patient oriented. We are focused on patient. not on the-
Dentist, if you have the skill, just write it down. Form.
Practo has its
I
own
like.
optimizing methods as well, but I think you guys are not optimizing.
So dentist will be getting.
They will getting the
Please.
revenue because they are getting paid.
Yeah.
They are not providing free service.
They will get
Plus they
revenue.
have
But you are
revenue.
not in the middle of that.
No. We'll be paying, we have a kind of a point system for the doctors that all the treatment which they are providing free of cost or the discounted, we have our algorithm where we're calculating the points for doctors, and on the basis of points we redeem them something like free dental materials, consumables, lab support if they need something, like we're providing them. Plus all the doctor who are doing much more kind of patients, they are getting much more reviews, feedbacks, so their ID will be much more popular among us. So if any other ex-user logs in and he sees that this doctor has treated 1,000 patients, this has done 100.
It's all organic.
Yeah.
So this is called insurance policy. right?
No,
We can't
it's a
use
health
word-
maintenance policy.
We
If you
can't
call it
use the word
insurance policy,
insurance.
I have to be insurance company.
Yes, exactly.
Yeah, it's not, we are not using
You
word
don't need
insurance.
any kind of license for this.
No, health maintenance
It's,
policy.
you can say it's a AMC.
Yeah.
AMC.
It's a kind of
In
AMC.
USA, you go. It's
And
HMO.
in India, government does not have any policy for dental insurance, so we really can't handle dental insurance.
They had
Because
last
of-
meeting in 2012.
Hmm.
They haven't done anything. Yeah.
From the past 4 years, there is no development.
Dr. Rajat, actually we are
Oh, no.
running short of time.
No.
So, thank you so much for guiding